Hi, I'm Rich Daly, and this is FastFinance, your quick hit of the news and numbers that matter in healthcare finance. Up first, weird numbers. These are some random healthcare numbers that recently caught our eye. Today's weird number is 500,000. That's how many people quit their jobs in healthcare or social assistance in August. That was the last month with a breakdown from the Department of Labor. That was also a higher rate of quits than the monthly quits during the healthcare pandemic's so-called Great Resignation, according to Labor Department figures. Those healthcare figures are also a bit of a head-scratcher since they run counter to the national narrative that all workers are clinging to their jobs amid broad economic uncertainty. Now for today's main story. More hospitals are implementing technology-driven screenings for their patients to automatically qualify for charity care. That's according to a recent industry outreach effort. Undo Medical Debt, a nonprofit which has worked to forgive $15 billion in medical debt for 22 million patients, reached out to hospital and health system finance leaders and others in recent months to identify challenges, opportunities, and lessons learned from implementing charity care presumptive eligibility approaches.
More and more we hear it's becoming more common, and hospitals need to think through how they can deploy these predictive analytic tools farther upstream in the workflow, where they might have traditionally just used them downstream as a part of their debt collection process. So in terms of how widespread it is, I don't think we fully know quite yet, but certainly in one-on-one conversations with hospital partners, it's something that is a more common conversation point.
That was Eva Stahl, Vice President of Policy Engagement and Research at Undo Medical Debt. Her organization's examination of incorporating presumptive eligibility screenings for charity care into financial assistance programs came as the American Hospital Association recently recommended the practice to finance leaders. Data-driven charity care eligibility screenings aim to move beyond traditional patient applications for assistance, which are unevenly used because patients may be overwhelmed by that process or never even pursue it because they avoided reading their medical bills.
It becomes increasingly important, I think, for hospitals to thinking about alternative ways to help people get to the financial help that they need and make sure they're getting credit for that charity care and reducing really the front load administrative burden for those working in revenue cycle and medical billing.
Using tools and vendors to access that data needed for pre-screening patients for charity care can be very expensive, so hospitals will need to justify that cost. Hospitals her organization has talked to have identified some benefits, including reduced administrative burdens for hospitals by redirecting revenue cycle staff from pre-screening patients toward dealing with denials, prior authorization, and other insurer administrative requirements. Data-driven front-end screening also may help some uninsured patients who are eligible for Medicaid to enroll in that program. Additionally, such tools can ensure hospitals are not inadvertently increasing their bad debt.
You definitely want to increase your charity care for your bad debt, right? So if you have non-paying patients, you would rather have them be in charity care than bad debt. Certainly because that counts as a community benefit, and you don't want bad debt on your books.
The approach also may help hospitals deal with the expected influx of uninsured patients in the coming few years due to reduced federal Medicaid funding under the One Big Beautiful Bill Act. But those approaches also can get in front of increasing state laws that mandate various forms of advanced screening for charity care or that target not-for-profit hospitals' tax status.
This is one way to communicate to patients that you care about getting them to financial assistance, and you're using predictive tools to help usher them through to the outcome for which they're eligible. And it also increases the likelihood that you can showcase where the harm of lacking insurance shows up within your own system and within your own revenue cycle, right? So as we see more and more people show up without insurance, or if they're underinsured, it also, provides a data point to communicate back to policymakers and decision makers that we're seeing an increase in charity care because we're seeing a reduction in government support of healthcare.
Hospital finance leaders will have to weigh the cost benefit of this emerging screening tool amid a quickly evolving state and federal regulatory and legal environment. Now, before we go, just one more thing. The new lawsuit seeks to stop the January 1st launch of the 340B rebate model. Hospitals have filed a lawsuit against the federal government on December 1st, seeking to halt implementation of the planned 340B rebate model before it begins. Plaintiffs hope to obtain a permanent injunction blocking implementation and an order requiring HRSA to rescind all related guidance and materials. In the interim, the hospitals have requested a temporary order preventing the rebate model from taking effect while the court considers the case. Safety net hospitals participating in the lawsuit fear the resulting financial constraints will force them to terminate or scale back service lines such as behavioral health, tele-oncology, infusion, and opioid disorder treatment. Among objections raised in the lawsuit are the presence of significant technical issues with the Beacon platform that the model plans to use. Related concerns are that the platform's terms of use appear to allow Beacon to sell the hospital data collected to drug companies. And another objection is that the pilot violated the Administrative Procedures Act. The APA requires any federal agency to allow for a comment period when implementing a major policy change and to respond to those comments. HRSA did not adequately abide by the second part of that mandate, according to the lawsuit. Well, that's all we've got for today. Don't forget, you can get the Fast Finance newsletter delivered right to your inbox every Wednesday. Sign-up info is in the show notes below, or you can go to hfma.org. I'm Rich Daly. Thanks for listening.